When we talk about the Budwig protocol, is that better for some conditions or maybe not advised for others? Does it fit better in certain categories for people?
Well, I think generally the Budwig diet, or elements of it at least, are good for most cases. There are a few cases where you have to be careful, and one of them is with surgery, right? If you're going to get surgery, you don't want to have such high doses of flax oil or any flax oil at all anywhere near that period of surgery, right? You don't want to create any potential complications with bleeding, for instance. The second thing is if you're on blood thinning medication, right? If you've been prescribed these kind of medications, you really have to work with your physician, right? Because you don't want your blood to be too thin. You want to have a good level of clotting ability, not too much, not too little. So, flax oil is part of that dynamic, and you have to work really closely with your physician and either adjust one or the other, right? The other one is if you have a reduced ability to clot. So it's more rare because in cancer, usually with cancer and cancer treatment, usually the problem is too much clotting. But there are some cases where some people have a lowered ability to form blood clots, and that could be from certain kinds of chemotherapy, but it can also be from progression of leukemia, for instance. So if that's the case, you don't want to have that unwanted risk of abnormal bleeding. So, if you're in that kind of situation, you really want to be careful and work closely with your physician. But otherwise, it's generally, like I said, it's either the Budwig diet or components of it are really useful for most cases. And to give you an idea, I think there's a lot of flexibility, room for flexibility. I have patients who, for instance, we might rotate out certain foods, even though they're recommended on the Budwig diet. They might have food intolerances to those particular foods, so we might rotate those out. I even have some patients on a completely ketogenic diet, but still following the principles that Dr. Budwig explained in terms of the types of fats and the distribution of fats. So there's really a lot of room for personalization, and especially when you're working in an integrative setting with conventional medicine, it's really important to adjust for these different factors.